You are tuned in to Let's Talk About Health with the Super Doctors, Dr. Amanda Flowers, Dr. Mark White, and Dr. Victor McKoy. Sit back, relax, and enjoy this presentation of Let's Talk About Health, where your health is your wealth, on AM 1580 WVKO The Praise, where we are the voice of the people.
Good morning, Columbus. Thank you for tuning into AM 1580 WVKO The Praise, the voice of the people. Welcome to Let's Talk About Health. I'm Dr. Amanda Flowers in the studio today with Dr. Mark White and Dr. Victor McKoy. Good morning, doctors.
Good morning, Dr. Flowers.
How are you guys doing this morning?
Doing good.
Doing good. Good morning, Dr. Flowers, Dr. McKoy, special guest.
Yes. Well, listeners, don't forget to visit our webpage at 1580thepraise.com/Let's Talk About Health, and like our Facebook page at Let's Talk About Health AM 1580 WVKO The Praise. We have a lot going on through Facebook, so you want to make sure you're in the loop. And if you desire to become a featured guest or sponsor our show, email me at ltah1580@gmail.com. Or do you have a question for our doctors this morning? Give us a call at 614-824-2139 or 824-2336. Well, nearly 2/3 of adult Americans are overweight, with obesity being a leading public health problem in the U.S., particularly among African American women. Despite the attention of health professionals, media, the public, and mass educational campaigns about the benefits of a healthier lifestyle, the prevalence of obesity in the United States has more than doubled over the past 4 decades. But weight loss isn't easy, especially when all odds are against you. And we have a special guest in the studio today who's going to help us understand how it can be done. So we are excited to welcome Miss Candice Mims to Let's Talk About Health. Miss Mims has a bachelor's in communications and public relations, a bachelor's in Spanish from Purdue, as well as a master's in science and marketing communications from Northwestern University. Miss Mims' career has centered around research in consumer marketing, and she is an active member of Alpha Kappa Alpha Phi Eta Omega chapter. I always mess those up. And Miss Mims is a family-oriented person, as her life centers around her beautiful 9-year-old daughter and her second family at Peace Missionary Baptist Church, where she is a member of the Dove Heart Worship Ministry team. We are glad to have Miss Mims because she has a wonderful testimony to share through her journey of health and weight loss that has tugged on the hearts of us all. Good morning, Miss Mims. It's a pleasure to have you with us this morning.
Good morning. Thank you for having me.
Thank you. Listeners, if you have a question, give us a call, 614-824-2139 or 824-2336. Obesity is related to a multitude of health complications, some that we hear about often, such as heart disease and diabetes. However, there are others we don't hear about as much, such as pseudotumor cerebri, which can occur in the children and adults, but is most common in obese women of childbearing age, typically under the age of 44. Pseudotumor cerebri is found in 1 to 2 people in every 100,000, but it increases up to 21 people who are obese out of this 100,000 will develop this condition. So obesity dramatically increases a young woman's risk for pseudotumor cerebri, and to the point that even women who aren't obese but experience a moderate amount of weight gain may be at an increased risk. So doctors, can you tell us this morning, what is pseudotumor cerebri and how is it diagnosed?
Yes, Dr. Flowers and Columbus community, pseudotumor cerebri is a condition where the intracranial pressure in the brain itself is increased, significantly increased, to the point where a patient is having symptoms with vision, headaches, lightheaded, dizzy, nausea, and a host of other symptoms. The problem with this with diagnosing this pseudotumor, and therein lies the name. It's pseudo. The symptoms are such as you would think a person had a tumor, but they don't have a tumor. But the increased pressure in the brain gives the symptoms. And so basically what happens is the intracranial pressure is increased, and basically the spinal fluid that's in that goes around the brain and goes around the spinal cord that protects it is increased. And so you have an increased pressure. And most people at first glance would think that a person would have a tumor because the symptoms are pretty. They can mimic symptoms of a tumor. But the further you get into it, you do a CAT scan, an MRI, you don't see a tumor. There's really no obvious cause initially for the increased pressure of this fluid in the brain and the spinal cord. And so that's sort of that's the definition of it, pseudotumor cerebri.
Okay. Dr. McKoy, did you have anything you wanted to add to that?
Dr. Mark answers that excellently.
Yes. Well, the symptoms of this pseudotumor cerebri includes headaches that worsen with eye movement, ringing in the ears that pulse with your heartbeat, nausea, vomiting, or dizziness, blurred or diminished vision with brief episodes of blindness that last just for a few seconds, difficulty seeing to the sides, double vision, and seeing light flashes, and neck, shoulder, and back pain. And you can imagine having all of these things going on. This can have detrimental effects on your daily function. Miss Mims, would you please tell us about your experiences with pseudotumor cerebri and how the process you went through with getting diagnosed with this?
Definitely. The way that I got diagnosed was actually waking up one morning and I had a spot in my eye and I didn't know what was going on. I went to work that day and just told my manager I had a spot in my eye and that I may go to the doctor. Didn't know what was going on. Didn't think much of it. That evening I just happened to go to the doctor. Just happened to be a random night that they were open late. When I went to the doctor, she checked me out with a normal eye exam, and she got really nervous and she backed away from me and she looked at me, and I was the first person she had ever seen who had pseudotumor, and she started to ask me questions if I had tingling down my arm, if I had ever had slurred speech, if my mouth had ever hung low, asking me about stroke symptoms because pseudotumor can also exhibit stroke symptoms. And when I told her no, that's when she explained to me that I had what they call papilledemia, because pseudotumor also, with the increased pressure on your brain, it squeezes on your optic nerves. So my optic nerves were increased, and they were pushing through my pupil at the time. So that was what was letting her know that I had increased pressure in my brain. So she told me that she would schedule an MRI for me. I didn't know how serious it was at the time, and the next morning, it wasn't even 8:30 in the morning, and they had an appointment scheduled for me that next afternoon. They took me to the doctor. I had MRIs done, and they were trying to find out, as you were stating, whether or not I had a brain tumor or not. And that was the hardest weekend of my life, was waiting to find out if I had a brain tumor. But they canceled out that it wasn't a brain tumor, and that's when they figured out that it was pseudotumor cerebri, because they realized it wasn't a brain tumor. But like the doctor said, stated, it was exhibiting all the symptoms of not being a brain tumor. And then from there, I had many tests to now figure out that it was pseudotumor cerebri, and then go from there to figure out how it needed to be treated.
And how long of a process was this? Because if I'm understanding correctly, you are in remission.
I'm in remission right now.
How long of a process was it from when you first got diagnosed and the different experiences that you had until you went into remission?
The first time, it took a little bit of time. I was first diagnosed in 2010. My symptoms were off the charts. They do certain tests where they try to see how increased the pressure is. They do spinal taps to measure the amount of pressure on your brain. they were able to decrease the pressure by doing the spinal taps, but just because they lower the pressure with the spinal taps doesn't mean the pressure stays down, and the pressure continued to increase. They couldn't get the pressure to stay low, so I had what they call an optic nerve decompression surgery, where they cut slits into the optic nerve sheaths around my eyes so the spinal fluid could drain out. So that lowered my pressure for a while, but that took, I was diagnosed at around September. That was done in December. So it took for all the tests to be done and for that to happen. That was October of 2010. I went into remission then. It came back around June of 2012. And I went back in remission in around September of 2013, and that was nothing but the grace of God, because I had to have 2 shunt surgeries where they insert piping into your brain to go into your abdomen to drain the spinal fluid. But when that happened, I did not know my spine was still leaking. So when I say the grace of God, I didn't know my spine was leaking. So when they inserted the shunt, it didn't return the amount of fluid that it should have. So they aborted the surgery and went to my spine. And again, it didn't exhibit the fluid that it should have. And they realized my spine was still leaking. So they did another surgery called a blood patch, where that was supposed to seal the spine, and the pressure should have gone back up, but it didn't go back up. So I've been in remission since 2013, but I went through tons of procedures on top of that, and my symptoms that second time were different than my symptoms the first time.
Oh, wow.
So it just comes back when it wants to come back, and it exhibits the symptoms differently. And the tests and the procedures were different due to the fact that my symptoms were different. So,
yes. And listeners, do you have a question about, are you experiencing a medical complication or a health complication that is hard for you to determine what's going on, or that you're experiencing some fear with what is happening to you? Give us a call this morning, 614-824-2139 or 824-2336. The doctor certainly can answer all of your questions, and Miss Mim can bring you some encouragement and hope for walking through this. Dr. White?
Yes, I just wanted to re-emphasize that optic nerve problem, because that's one of the main problems. There's a lot of problems that are associated with this problem, but that when that optic nerve, and that's the nerve that goes directly into your eye, when that optic nerve has increased pressure around it, therein lies the problem. And so, just on just a basic kind of level, if you have any kind of visual problems, double vision, you're seeing spots or anything like that, don't take that lightly. A lot of people will say, I see little floaters. They'll come in and they're taking that lightly. It could be something very benign, or it could be something else. And so I would challenge the listeners, if you haven't had an eye exam and you see something, you start to experience these symptoms, go get checked. So I had one story I want to tell us. I had one patient that was in Cincinnati, and I got a call because the symptoms were so, as Mrs.
Miss Mims.
Miss Mims has mentioned that the symptoms are really, they're very unusual. And you don't know, you have these eye changes, you have the nausea, vomiting, lightheaded, dizziness, and you're just wondering. And a lot of times the doctors, it stumps them because they're thinking a tumor or aneurysm. They can't find. This one particular patient was sent to Cincinnati, hospital in Cincinnati, hospital in Dayton, and finally the Ohio State diagnosed them with this pseudotumor cerebri, because there's really no cause why this pressure goes up. Dr. McKoy?
I'm absolutely amazed at the ability to even diagnose some of the things that we diagnose. It is, I want to say this, it's a wonderful day in which we live in, how we can kind of systematically and empirically go through an analysis of your cerebrospinal fluid, your brain fluid, and just what's going on, because I saw a report there were over 12,000 diseases, and one of the things about this day we live in, there are more doctors, more gifted at doing what we do, but yet it seems like all along the diseases become more elusive and more complicated, and diseases become recategorized and revisited with a different type of diagnosis. We do have, yes.
Yeah. Well, we have a question. You can finish. They didn't want to be on the air, but we do have a question.
Okay, we have a question.
Yes,
doctor.
The question, a caller called in and wanted Miss Mims for me to ask you this about the pain of the headaches. How severe was the pain that you would get, and how did you deal with that?
The pain is great. I've always had headaches as a child. I had been diagnosed with migraines as a teen, prescription medicine as a teen. The pain from these headaches is debilitating. There were times that, my ex-husband would have to pick me up from work. I would be in my bed, couldn't move. They're similar to migraines. It depends on the day and the moment. A lot of times I would jokingly refer to myself similar to a functioning alcoholic, because you would learn how to work through the pain because you're just so used to it. And a lot of times people look at you as, oh, it's just a headache, because they don't understand that this pain is so great. And people just think of it as just a headache, but it's more than just a headache, because
it would even make you pass out, right?
Yeah, like the headaches, sometimes it would be just one side of your head, and sometimes it literally takes over your head. Sometimes, like I'm in different groups on Facebook for people who have this disease as well, and I've asked the question to other people, because sometimes you want to make sure it's not just you, that my headaches give me a burning sensation in my head, and I don't know how else to describe it, but it's a burning sensation, and I wanted to make sure it wasn't just me, that but it literally feels like my head is burning, and I don't know how else to describe it. But the headaches also come in different forms and fashion. So, and
I can imagine trying to cope with this, but what was the easiest way? I mean, did you just go to sleep, or could you even sleep with it, or how did you kind of deal with it?
Sometimes sleep would help. Sometimes it was just dealing with it. Sometimes you just learned how to work through the pain. Yes. Sometimes you just learn how to push through it.
Were there any pain medications that would they help at all?
No. And that's the thing. Sometimes people would ask if I took medicine, but sometimes it just didn't.
Okay. Well, you are listening to Let's Talk About Health on AM 1580 WVKO The Praise, the voice of the people. Please join our show with your questions after this break by calling 614-824-2139 or 824-2336.
You are tuned in to Let's Talk About Health with the Super Doctors, Dr. Amanda Flowers, Dr. Mark White, and Dr. Victor McKoy. Sit back, relax, and enjoy this presentation of Let's Talk About Health, where your health is your wealth, on AM 1580 WVKO The Praise, where we are the voice of the people.
Welcome back. You are tuned in to Let's Talk About Health on AM 1580 WVKO The Praise, where we are the voice of the people. I'm Dr. Amanda Flowers in the studio today with Dr. Mark White, Dr. Victor McKoy, and Miss Candice Mims, discussing weight loss when health complications get in the way of exercising. Give us a call with your questions at 614-824-2139 or 824-2336. And before we went to the break, Miss Mims was answering a question about the severity of her headaches and how she dealt with it. And Dr. White, you were going to explain to us about the root of the headaches and why they're different from other headaches when you have pseudotumor cerebri.
Right. And Dr. Flowers, we typically when a person has a headache, whether it's a migraine or just stress or other different kinds of headaches, they stem from our arteries, basically. There's a dysfunction there. But in this particular type of headache, and the reason why it's so severe, and typically patients will complain of burning, numbness, tightness of their head, is because it's specifically due to the pressure that is building up in the brain between the skull and the brain tissue itself. So the headache is it's almost like someone is squeezing your brain tissue. And so it can, it's like no other, it's like none other. People complain of the visual, nausea, vomiting, like someone is literally squeezing their head. And so the headache, so treating those headaches, the standard medications don't typically work in those scenarios.
Okay. Well, everyone, as your body changes, so does your image of yourself. Body image is the mental representation one creates, but it may or may not bear close to relation to how others actually see you. Body image is subject to all kinds of distortion, and it strongly influences behavior. Preoccupation with body image is widespread among American women, and to the lesser extent also American men as well. And sometimes I think just with our men, they don't express the concern with body image as much as the women do sometimes. But this developing a positive body image and healthy mental attitude is crucial to happiness and wellness. And Miss Mims, even while dealing with pseudotumor cerebri, I am excited to let our listeners know that you pushed through to lose an entire 137 pounds.
Wow.
And yes, and this is, I have to let you know, people have just been calling me, sending me messages on Facebook. How do you get this? I have a meeting. Are you recording it? Can I listen later? I need this. I mean, people are just keep saying, I need to hear this. I think sometimes we forget how often we talk about physical health and exercise, and we do need to do those things, but I think sometimes we forget people have health complications that if you're dizzy and getting sick or you can't move, that can impact this. So could you tell us how you pushed through to lose 137 pounds? And you looked amazing before, but all I can say is wow now. What was your motivation for weight loss?
Thank you for saying that. My motivation was I needed to feel like me again. I looked in the mirror and I didn't see myself, and I hated what I saw. And you're not supposed to feel that way. When you look at yourself, we're made in God's image,
yes,
and we're supposed to love what we see. And I didn't feel like me again. And I didn't feel like me, and I needed to feel like me. And from stress and bad relationships, and I gained 70 pounds when I had my daughter, and then illness and medicine, I had put on 30 pounds from medicine. Things just kept adding up in my life, and unfortunately it was adding on to my body, and so that was not helping me. And at first it was hard for me to exercise just mentally, because I had to find the time because of just life and my work schedule, and coming home and still having to work, and then take care of my child, and just get things together at home was hard. But then when my illness came back the second time around, it got to the point where if I got hot, I got sick, and I would start to pass out. I would throw up, so I physically could not work out. So in 2011, actually, when I was first in remission, I joined Weight Watchers, and that was what had me lose the weight this time. I had joined Weight Watchers in the past, and so I knew it worked. I had lost some weight with them before, but I just stuck it out with Weight Watchers this time, and I told myself I was going to do it. And when I saw the weight starting to come off little by little, I just stuck with it, and I just had little goals, and 5 pounds here, 10 pounds there. I didn't set my sight and say I'm going to lose 100 pounds. I just said I was going to get to a point where I felt like me again, and I felt better. And when I saw the weight coming off little by little, that's when I started to feel better about myself. And then when I started to see the change in the mirror, it was like, wow, I can do this.
Yes.
And the next thing I know, 137 pounds later, I felt like myself, and I was fitting back in clothes, and I was actually buying new clothes because I didn't have clothes anymore, and it just felt good. And so I just changed the way I was eating, and it was not even that I stopped eating the things that I wanted to eat, because I continued to eat what I wanted to eat. I didn't deprive myself. I just changed the amount that I was eating and how I was eating.
Wonderful. And one of the things that she was telling me about, and this reminded me of of you, Bishop Dr. McKoy.
Oh, boy.
And that one of the things she loves to do is sing in the choir, and she has a beautiful voice.
Thank you.
And even when she would feel the spirit, this would make her sick and cause her to get sick, and she would pass out and things. What motivation do you have for, especially our church members, when you start having health problems that are impacting your, when you feel like, because I remember Miss Mims told me, you don't take the one thing that I really, need.
Yes.
Have you encountered this, and what motivation do you have for our people to keep striving?
One of the things, you have to be able to take one day at a time. You have to be able to take one day at a time, and you have to stay consistent. The word discipline is in the Bible one time. King James text one time, and that's Job 10:36. I believe it's Job 10:36, or either 36 and 10. And it's a form of the word disciple or whatever. But discipline, you have to have discipline, and sometimes discipline doesn't mean that I go out and do 45 minutes a day. Because one of the things that has been proven is that when people that are, let's say, morbidly obese, they're larger than they should. If they would do 45 seconds or 30 seconds of vigorous exercise, it would actually benefit them much better than someone who's normal size doing sometimes a couple of hours of exercise, because your body, God has designed this body, this temple so well until once you engage in a certain kind of focused activity, it will polarize itself every phase of your physiology, trying to help you. So 45 seconds for someone who's 100 pounds or a couple 100 pounds overweight, you'll be surprised what it does. But you have to be consistent, and you have to make the effort, because it's not over. It's not over, just consistency.
Yes. And we had another caller call in. This caller did not want to be on the air, but has two questions for you, Miss Mims. The first question is, what kind of support did you need going through this? And then the second question is, could you expand upon the vision problems that you were having a little bit more?
Mm-hmm. I could talk about the vision problems real quick.
Okay.
For me, with pseudotumor, one thing that happens is your peripheral vision will go. And one of the tests that I would go through every time I would go to the doctor is a field of vision test. So normally when you go to your doctor, you do a field of vision test, and it takes maybe 30 seconds to do. But my field of vision test normally takes about 3 to 4 minutes to take. And my field of vision was going, but it wasn't as bad as some. There are people I know who have lost their sight because of pseudotumor, but mine wasn't affected as bad. I have some issues with my vision. I have what we call tracing, just to make it a little, like, to give it coin it a term. But at night, a lot of times it seems like lasers. Like I see lasers where I look at things and lights follow me, and I can. I have issues with that. Kind of like when you look at lights and you see like the fuzz around them. But just imagine like seeing lines going everywhere. I have that a lot at night. But aside from that, I really don't have vision issues anymore, thank goodness. As far as the second question, the type of support that I needed, I had a lot of support from my ex-husband. He was definitely there during my illness. There was a point in time where I couldn't drive. And for about a month and a half, I couldn't drive. My church family was definitely there because for a couple of months I couldn't sing. And so how you were saying, like, don't take the one thing from me, I couldn't sing for a while, and that killed me. And they were there. I would still go to church, and they would watch me having to run out of the sanctuary so I could make it to the bathroom, because I still wanted to be in there. I still wanted to be in the spirit, but I would get sick, and they just let me, run out and, just be in my moment. But my ex-husband was there, and he supported me a lot. My daughter, even as young as she would still be there and, like, rub my back and, try to hold my hand. And she was there. And my family, my mother came in town, and she stayed with me during my surgeries and, supported me that way. So it did help a lot having that support, because it's definitely a hard disease to deal with, especially when you don't know what your body's going to do. When I first got diagnosed, in comparison to when it came back the second time, my symptoms were completely different. I went from having severe headaches all the time and some dizziness to passing out and dizziness and being unable to drive. So you definitely don't know what's going to happen when it comes on. So the support system is definitely needed.
Yes, and it sounds like there's also support systems through Facebook, and I would imagine there are certain support groups that you can actually physically go to. So if anyone out here is suffering from this, get on the internet and research things, or call us in here. I mean, if you don't have access to internet and you need help researching support groups, we are always willing to help you find those things, and we can also put you in contact with Miss Mims, because she may be even better at guiding you for finding specific support than what we are sometimes. It's something about going through the journey that will make you so much more knowledgeable than knowing about the illness sometimes. And you know, research shows us, and we talk about this all the time. I mean, every time we have a show about health and fitness, we talk about physical activity. And Dr. McKoy was even mentioning it earlier, and getting regular physical activity. A lot of times I've even seen it, and I saw this quote, is the only way to maintain weight loss. And Miss Mims, with all of this going on, how physically active were you during this journey? How often did you actually get to exercise?
I couldn't, just because, I mean, literally the slightest bit of heat, and it was upsetting, but the slightest bit of heat sent me into I would call it tizzy, and I would start to pass out and I would throw up. So I couldn't do anything. So it was literally being disciplined and watching what I ate and sticking to a healthy diet. And like I said, I didn't deprive myself. So a healthy diet consisted of, I love fresh fruit. You know, I'm not that big on vegetables, but I love broccoli. I love green beans. You know, I do eat some vegetables, but I didn't deprive myself. You know, Popeyes is right on the end of the street of my church. So if I wanted chicken, you know, I got chicken. If I wanted Chinese, right, you know, I got Chinese. So I didn't deprive myself, but I also ate it in moderation, because I knew that if I didn't get it, when I did get it, I would eat too much of it. So I just learned to, you know, do it right.
Tell us about this cake. You were telling me about cake the other day. I'm a couple of bites of cake to suit your taste. I mean, this is what she's telling me, and I'm like, I probably need to do that.
Like if I wanted cake, you know, if I'd be out somewhere and they had cake, I could get a slice of cake, but I only need a couple bites of it, just enough to get the taste of it and satisfy me. Then I don't need the rest of the piece of cake, because I got what I needed and I tasted it and it was good, and then I'm done. I don't have to, like with Weight Watchers, you count points. I don't need to take the whole 7, 13, how many number of points for the piece of cake. I can take what satisfies me, and I'm good. Yes. Now I can keep on going, and, you know, until the next time. So, you know, I'm good with that.
Good. And Dr. White, I think you were going to say something about the physical activity in situations like this. Do you see this often, where people's physical activity is limited?
Absolutely, we do. A lot of people have arthritis, and they have back pain, and different things that limit them. And I always say that losing weight. One of the things that Mrs. Sims has said, and I can feel it in her energy, is that discipline, that consistent discipline. And I think that Dr. McKoy mentioned this. You know, it's a little bit each day. It's just a little bit each day. And I think a lot of times we as human beings, we think of I have to do X, whatever that is, weight loss or whatever, and we think we got to do the whole thing, and so the whole thing scares us, and then we don't end up doing it. But as Ms. Sims has said, as I'm listening here and feeling her energy, it was just the consistent thing. She only ate a little piece of cake. The amount of food that she ate, she decreased that, and she kept on that thing. And so I think that what I was going to say was that 80% of weight loss. This is what I've read, and 80% of weight loss is eating, 20% is exercise.
Oh wow!
Yeah. So I mean, what we put into our bodies, if we put a whole bunch of food, then we're going to have to do a whole bunch.
Yes.
Decide. Dr. McKoy, take it.
Sugar is a toxic substance.
All right. Well, you're listening to Let's Talk About Health on AM 1580 WVKO The Praise, the voice of the people. Please join our show with your questions after this break by calling 614-824-2139 or 824-2336.
You are tuned in to Let's Talk About Health with the Super Doctors, Dr. Amanda Flowers, Dr. Mark White, and Dr. Victor McKoy. Sit back, relax, and enjoy this presentation of Let's Talk About Health, where your health is your wealth, on AM 1580 WVKO The Praise, where we are the voice of the people.
Welcome back. You are tuned in to Let's Talk About Health on AM 1580 WVKO The Praise, the voice of the people. I'm Dr. Amanda Flowers in the studio today with Dr. Mark White, Dr. Victor McKoy, and Miss Candice Mims, and we are discussing pushing through to reach your weight loss when health complications get in the way for exercising. Give us a call with your questions at 614-824-2139 or 824-2336. And we have a caller on the line. Caller, you are on the air. Do you have a question for us this morning?
Good morning, Super Doctors. This is Lady DeWanda Thomas of Purple and Pink in the Truth Church. How are you?
Good morning, Lady Thomas.
Good morning, Lady Thomas.
Good morning. Good morning.
Good morning.
Now, are you beside a radio?
My radio is off.
It's off. Do you have your phone on speakerphone?
No, I don't. Am I getting in trouble, Super Doctor?
You are in trouble. No, we were having a little bit of echo, so it may just be in from communicating from your phone to ours. That's fine.
Yeah, I'm in the car, but my radio's off. My son's driving, and he's a good driver, so I'm paying attention to your show.
All right.
But what I was calling to say, and Dr. McKoy beat me to it, that cake, 1 or 2 bites that you can take, it's a toxic substance, so we can't have that cake. Just kidding. And I can't just have 1 or 2 bites to take, so Dr. McKoy has to pray for me.
I promise I'm praying for you.
Thank you. I appreciate that. I did have a question about the headaches. For someone that may have had headaches from childhood, I heard that mentioned earlier, and in adulthood, chronic headaches, that can be a little debilitating, but are just controlled by medication over the counter. Is there something that they need to do to kind of determine what might be going on? They're not having any vision problems or anything, but what type of test or anything that you recommend? And I'm going to hang up on my radio so I can hear you.
Okay, thank you, Lady Thomas. We love you, and you are one of our number one fans. And listeners, before we answer her question, I want to make sure you tune in next week, because next week is the Purple and Pink Walk for Life and Family Fun Fest, and we are going to be covering that on our show. Next week is also our radiothon, so we are going to be having our show in the parking lot, and we're going to be talking back and forth with Lady Thomas. So it's next Saturday, the 25th. Her event starts at 8:30, the Walk by Faith and the Family Fun Fest at 10 a.m., and ours starts in a parking lot at 10 a.m. as well. So make sure that you are tuned in. We'll be here from 10 to 6. Now, doctors and Miss Mims, she was asking about the headaches and the test for the vision problems.
I know. I was reading Dr. Daniel Amen's book. He's got a couple books out there, and he's a neurologist. And there are several different types of spectral scans and scans that can tell you what's going on neurologically in the brain. But even at that, the human body is so fearfully and wonderfully made. Sometimes, no matter what medical diagnostic tool you lay to it, you still can't diagnose where this headache is coming from. A headache could come from a TMJ problem, it could come from a tooth, could come from a sinus problem. It could be, as Dr. Mark talked about, the arteries, and it could be arterial in nature. So you can never, but one of the things that we do know is that once you eliminate certain things from your diet, there are some things, you hear them talk about brain decay, but I deal with tooth decay every day. Then I started reading about brain decay and all of these things associated with sugar and different things in our diet. We have so many different types of sugars that are artificial in nature. Aspartame was one that was proven to cause headaches in like monkeys and different lower primates and species of animals. And so you never know, because Big Pharma, and I'm sorry for going this direction, Big Pharma has such a great interest in the profit until a lot of stuff is covered up by our own FDA. Sorry to say that, FDA and Food and Drug Administration. A lot of stuff is covered up. And something that would probably be okay if somebody came from the farm and the country like Dr. Amanda Flowers, because you had the good mama fixing meals and all this stuff, not a lot of fast food. But we know that when we have this fast food diet, and we're just going to put any type of substances in us to kind of help us do, just to get calories in, it can be a major problem. So I'm going to step back and let Dr. Mark.
And these things we put in our bodies are impacting our brain functioning.
Yes, they are. They are impacting it because, I have a list of things in front of me here that will help build up and rejuvenate brain tissue. We don't have time.
Well, no, we have those listed.
Is that list on the website?
Thank you. But we have another caller, and we're going to answer the vision part as well. But caller, you're on the air. Do you have a question for us this morning?
Yes, ma'am. This is Minister John Wooden.
Well, hi.
I just want to say God gave me a dream day before yesterday. And the question is about my liver, the cancer in my body has shrunk twice in, 3 times now in my pancreas. And it has one polyp that has kind of increased on my liver. And the Lord told me to call you guys and ask my doctors. So I want the world to know you're the God's doctor, so we're doubly blessed. And I just want to say next month will be 1 year, and they gave me 3 months to live. So the doctors is happy and ecstatic. And my question is, do you guys have, until you tell me, some healthy herbs that would help your bladder? I mean, your liver.
And I have your number. I still have your cell number on my phone and iPad, Minister Wooden. And I'm going to call you after we get off the air. I will call you immediately. I got a couple of things that I have to do, but I'm going to call you within probably a couple hours after we get off there. There are so many different things. One of the things that I've learned over time, there was a time when I personally chased every herbal product to try it out, and I have like a mini pharmacy in my Lazy Susan at home. There's no food there, it's just all kind of herbs, vitamins, minerals, and things of that nature. But then what I did over time, I started tailor making that for what I needed for me, and I knew, and so I started going back to a basic taking the vitamin E and the selenium, which is good for immune system support and good for heart support, and then doing the things that build my liver. So I basically started more or less not just taking everything, let's say, that you see on TV and that Dr. Oz would recommend, because it would be about 260 things that you get a new group of things every day. And you really can't live life like that if you're not a multi-millionaire. So I narrowed it. I started focusing on what I needed to do. I did that exercise bit, and stayed focused. And I kept my sugar, because I really never really had a sugar craving or sugar. That's just a gift that God gave me. I never, people can put cakes and pies and all that stuff around me, and I'll semi-nibble at it maybe. But I never had that. But I had to get me back to a place where everything is basic and everything is simple. And I'll talk to you about that off the air, Dr. Mark.
And thank you, Minister Wooten. We are certainly happy that you called in, and please continue to listen to our show every week. And Dr. White, one thing, when Lady Thomas called in, she was asking about how to diagnose the vision problems. If you can expound up on that, and then if you had anything about the the liver, cleaning out your liver as well.
Yes.
And then we, for our last few minutes, we want to hear from Miss Mims about what do you put in your shopping carts and all that stuff.
I will say that there are different types of headaches out there, and a neurologist, they do have certain tests that they can do to say if it's a migraine versus a tension headache, and there's a few other ones out there. So there are specific tests, and I can't give you those tests. I don't know them by heart, but I would say that seeing a neurologist, and there's a few neurologists at Ohio State that specialize in headaches, and so I think that going to see them and getting evaluated would be the best advice I would give on that.
Okay.
Headaches and visual problems.
Wonderful.
Yeah.
And most of us are creatures of habits. We buy the same foods, we prepare the same recipes, we go through these same routines over and over, and we know losing weight isn't easy, but it takes a lot of commitment, and we get so comfortable that sometimes it's hard to give up these habits that we have. And we know that experts emphasize the importance of having a balanced diet for good health, and this is one thing I've had a lot of people telling me they're excited to hear. What do you eat? How do you eat? What eating habits do we make? And I've actually told Miss Mims and I were talking about, it's not even changing your eating habits. You change your lifestyle. It's a whole new eating lifestyle. So Miss Mims, can you tell us how did you change your lifestyle? What secrets do you have for us? How many meals do we eat a day? What do we do to make sure we have balanced diets? What do we put in our shopping carts? And I know that's a loaded question, but all of those little secrets, if you can tell us what you were doing. And before you answer that question, we have a caller on the line. Caller, you're on the air. Do you have a question for us this morning?
Yes. Yes. First of all, I want to say I love my favorite doctor. This is my number one. And the question is, let me turn my radio down.
Thank you.
Okay, I went to the eye doctor the other day. And they did say that I do have diabetes. She's seen when she checked my eye.
And what is your question for us?
The question is for Dr. Mark, what does it mean?
I'm sorry, what's your question again? I'm sorry.
Dr. Mark, what does it mean?
For your diabetes diagnosis?
Right. Yeah. Right. So I think if I'm hearing the question properly, you're asking if there is an eye disorder associated directly with diabetes, and is that right? And there is a eye disorder associated with diabetes. It's called diabetic retinopathy, and a long word that means that a person can go blind from this. And at one point in time, it was the leading cause of blindness. And so the take-home point on that is, if you have diabetes, you want to get your eyes examined once a year. So you definitely want to have those eyes examined, because patients with diabetes can acquire this diabetic retinopathy. So get those eyes examined once a year if you have diabetes.
Thank you, and thank you, Pastor Georgia. We love you. We know that you are one of our number one fans as well, so we appreciate it. Miss Mims, what do we eat to lose 137 pounds with minimal to no exercise? Right. we even have Sonia with the C. She is a sweetheart. I have to let you guys know she is editing our shows, so they're going to start being uploaded on our website. She has been making us coffee, helping train me on the board, and this is going to be scary, and all of this. And now she is so quiet, and she's sitting back there saying, yes, how do we lose weight with eating right? So Miss Mims.
One thing is drink a lot of water. You have to definitely drink a lot of water. That helps a lot, just flushing your system, keeping you balanced. fruits and vegetables, making sure you have a lot of fruits and vegetables. I don't know the exact serving size, but I know, is it 5 to 6 servings a day? I believe. Right. Vegetables and fruits a day. I believe it's like 2 servings at least of dairy a day. Lean meats. Trying to keep a lot of lean meats. I know that's one of the things Weight Watchers, I'm trying to think of everything that Weight Watchers teaches us, but I try to make sure I do that. I need to eat more vegetables. I keep to the same ones, but I need to open up my variety of vegetables. But those are the things that I try to make sure I stick to. Again, I do have my sweets. I do eat mine. I do dip out. But
and I think that's the key, too, is we don't want to deprive ourselves. Just eat things in moderation. And one thing you were telling me is that if you have a day, if it's Thanksgiving and you eat everything under the sun, the next couple of days you just manage. Or if you eat McDonald's for breakfast, you eat healthier the rest of the day.
Right.
And Dr. McKoy?
And you said broccoli was one of your favorites.
Yes.
And that's cruciferous. And so that's low sugar. And that's going to help you lose weight. And as a matter of fact, it's going to facilitate your body pulling fat out of your bloodstream. Yes.
And Dr. White, did you have any advice on balanced diets and what you put in your shopping cart?
Yes. One thing I would add is to make sure that you're getting enough protein. Make sure you're getting enough protein. And I would say for just average person, average adult, 40 to 60 grams per day. Protein is very important for everyone, so make sure you're getting enough protein.
And thank you, everyone, for listening to Let's Talk About Health on AM 1580 WVKO The Praise, where we are the voice of the people. Tune in next week as we have our Radiothon, and we cover Purple and Pink Walk for Life and Family Fun Fest. And we are going to be talking about family fitness with our featured guest, Elise Berry from Hot Box Fitness. In the meantime, remember to stop by our studio at 3360 East Livingston Avenue, Suite 2A, and show your support by giving us donations. And remember, your health is your wealth.
Let's talk about health.
You have been listening to Let's Talk About Health, where your health is your wealth, with our super doctors, Dr. Amanda Flowers, Dr. Mark White, and Dr. Victor McKoy. Tune in every Saturday from 10 a.m. to 11 a.m. for Let's Talk About Health on AM 1580 WVKO The Praise, where we are the voice of the people.